Good. All right, well, time is now 9:35. Veterans Day, of course, is tomorrow. Some armed forces members can struggle with mental health after their service.
To help, psychologist Dr. Laura Saunders from the Hartford Healthcare Institute of Living is checking in with us today. How are you doing this morning?
Hello, friends, and happy Thursday.
Happy Thursday to you as well. All right, so what are the most common concerns for veterans after they come back from a combat tour, Doc?
So, we like to give shout-outs to our veterans. Tomorrow's Veterans Day.
Yep.
But what's really important to make the connection to is veterans and mental health. There's three common concerns for veterans is post-traumatic stress disorder, depression, and sometimes traumatic brain injury. Especially those who have served in combat generally have experienced more stress and trauma in their lives than non-veterans, and we know that they also have higher rates of substance use and homelessness.
So that's a lot of stuff to have on somebody's plate. What can we do and how can we show that we care and help?
So I think it is about making connections for individuals, like other vulnerable groups. They can struggle with depression and even suicide, and we know that the suicide rates are higher. So connecting with the right resources. I think the military, I've actually a couple of close friends that are connected to the military or who are veterans, and I think overall the military has done a much better job talking about mental health issues and making those connections, because as we know, there is no physical health without mental health.
You know, Doc, it's like almost as if they have to talk about it. With the veterans have a 57% higher suicide rate than people who haven't served. Is there anything that, we can do as civilians to help reduce this risk?
Well, I think it is about, supporting our veterans and supporting services for veterans. Very often on, different lights, you'll see someone holding a sign, I'm a veteran and I'm homeless. So I do worry about those individuals, but it's really about supporting the right resources for them. We do have resources here at Hartford Healthcare Center for Healthy Aging, and we do know that they have additional vulnerabilities. So like any other vulnerable group, we want to reduce access to lethal means, take away lethal means to our those veterans who carry more risks than the rest of the population.
So, Dr. Saunders, obviously we're talking about this because tomorrow is Veterans Day, but this is something that we should be talking or checking in with veterans or service members probably every single day, weekly, monthly. How can we make sure that we're doing that in a way that's supportive?
So, yes. While tomorrow's Veterans Day and veterans carry some of the burdens with them every day, and so always thanking them for their service, but at the same time really trying to make sure that they're connected to organizations like the Veterans Administration or the Veterans of Foreign Wars. Those are good places to start. Thanking a veteran is one thing, but realizing the sacrifices that they've made for us are very great.
And, accepting counseling is a good thing, Doc, right? It's not, there should be no stigma associated with this. It's just saying you need a little help and that you, the professionals, are there to help these people.
Right.
Yes, and what we try to emphasize is that accepting help is the greatest sign of strength, as opposed to pretending that a problem's not there and trying to push it aside. So, and as I said, the military's done a much better job in opening up mental health resources and making them more accessible and working on taking away the stigma.
Well, that's awesome. Well, we can't thank you enough for your time once again. Always good advice, Doc.
Thanks, Dr.
Yeah, and a shout out to my best friend, Colonel Mel Graff.
Okay, you got it. There you go. There's your shout out.
And we say thank you to all of our service members and the canines.
And the canines. Thank you so much.
And the canines, that's right.
All right, we'll check in with you soon.